Good day, we are Group 1 and we will present our case study entitled Areas and Benefit Analysis on Selective Catalytic Reduction in Addressing Air Pollution from Nitrogen Dioxide Emissions in Wuhan, China. Your today's reporters are Ms. Bawar, who mainly contributed for the background information and conclusion, Ms. Cruz for the three technologies that are to be analyzed for benefit analysis and the recommendation, Ms. Logmao for the background information and benefit analysis with project, Ms. Orcilla for the benefit analysis with project and conclusion, and Ms. Soon for cost-benefit analysis without the project and methodology. All group members contributed to the risk assessment and risk management part.
Let us first start with some background information of Wuhan, China. So the name of the city is Wuhan and it is located in the Hubei province of People's Republic of China. The total area is 8,494 square kilometers and the population to be considered in this case study is 11.08 million in the prefecture level. As for Wuhan's economic status, it historically grew its economy through trading. In the 1950s, iron ore and coal deposits were found, and with that, the first steel and iron complex was made in Hanyang. Note that Hanyang was one of China's past cities made in the Sui dynasty, and it was merged with the cities of Wuchang and Hankou to form what Wuhan is today. With that, it became a major industrial producer for the entire country by providing millions of tons of steel every year. As for the industries in Wuhan, there are three: steel production, automobile industry, and commerce and trading. Here we have the details for each of these industries.
Ecosystems in Wuhan. Wuhan is located at a fairly low latitude at the 30th parallel and is 630 kilometers away from the sea, which causes it to have a temperate climate with relatively cold winters and hot, muggy, and rainy summers. It has no clear boundaries between its seasons, which are spring, summer, and autumn. Wuhan is also home to a lot of exotic and wild animals. In fact, China is known for its wet markets where wild animals are sold. It is suspected that COVID-19 outbreak started at a wet market in Wuhan, and in response to the outbreak of COVID-19, Wuhan decided to ban eating wildlife animals.
An assessment on air quality status in Wuhan, China showed that air quality has improved marginally in recent years. Although the NO2 concentration continues to rise, the PM10 concentration is clearly on the decline. Also, in 2008, the SO2 concentration has been slowly decreasing. Nonetheless, existing air pollution levels are also very high, with PM10 and NO2 levels breaching air quality standards. The lockdown that occurred in Wuhan, China due to COVID-19 resulted in a relatively large decrease in air pollution in the city. There was a reduction of 63% in nitrogen dioxide concentration in the atmosphere of Wuhan. This article even suggested that lockdowns can prevent up to 496 air pollution related deaths in Wuhan and 10,822 deaths in China as a whole. The reduction of nitrogen dioxide during lockdown is possibly due to the fact that fuel consumption has been put on hold during this lockdown.
Health status in Wuhan. In December 2019, several cases of COVID-19 has emerged in the city of Wuhan, making it the ground zero of the coronavirus pandemic. The virus spread rapidly due to the celebration of Chinese holidays, and more cases started to appear in nearby provinces. Wild animals sold in the wet market are suspected to be the source of the novel coronavirus. Not long after, the virus has spread all over the world and has gained global attention. The city of Wuhan is officially free of COVID-19, a year after the first case of the virus emerged. This proves that the city has successfully flattened the curve and its pandemic response is effective. The third is other environment-related diseases. The table shows the top leading causes of death in China. This epidemiologic data shows that the top three diseases linked to environmental factors in the country are stroke, lung cancer, and stomach cancer. Moreover, the GBD study of 2019 presents that air pollution is one of the top risk factors that drive most death and disability combined.
Life stages of population. Due to the unavailability of demographical data for Wuhan, the following data are based from China. This graph shows the data between the population of rural and urban areas in China from 1955 to 2020. In year 2020, 61% of the population of China is urban area, and 39% is from rural areas. Thus, the graph shows an increasing population in urban areas from 1955 to 2020. Next is the male to female ratio. As of 2019, 618,596,325 is the population of female, which is 48.69% of the total population, and 717,118,675 is the population of male, which is 51.31% of the total population. Next is the age distribution. The graph shows the population percentage of ages 0 to 14 and working age from total population in China. For ages 0 to 14 group population, it shows that the population were decreasing, while for the working age group, it shows that the population decreased from 1995 to 2010 and was increasing from 2010 to 2019. Lastly, for age distribution, this graph shows the population with age 65 and above in China, and it shows that the population was increasing since 1965 until 2019.
China has numerous policies and regulations concerning pollution. The basic legislation for environmental protection in China is the Environmental Protection Law, which was issued and adopted on September 13, 1979. It is established in accordance to Article 11 of the Constitution of the People's Republic of China. Other environmental policies are Environmental Protection Law of the People's Republic of China, China's New Energy Vehicle Mandate Policy, PRC Law on Prevention and Control of Air Pollution Prevention Regulation of Hubei Province, Ambient Air Quality Standard of PRC, and Integrated Emission Standard of Air Pollutants. For problem identification, based on the environmental quality status and health status, the main problem of Wuhan, China is air pollution. Wuhan is among China's polluted cities, ranking 146 globally in 2019. And as of September 1, 2021, the air quality index in Wuhan is shown to have a value of 119, which is unhealthy for sensitive groups. One of the largest contributors of air pollution is nitrogen dioxide emissions from the use of gasoline or diesel-powered vehicles in the city. This continues to aggravate as vehicle numbers continues to increase rapidly. Based on the identified problem, the general objective of this paper is to provide a risk and benefit analysis for selective catalytic reduction technology in addressing air pollution from NO2 emissions caused by the use of gasoline-powered vehicles in Wuhan, China, and to provide a technological alternative for this environmental problem. Specifically, the objectives of this case study are the following: to evaluate the effectiveness of selective catalytic reduction, to provide suggestions for other technological alternatives to address the NO2 emissions, and to provide the basis for deciding whether to continue the operations of SCR.
For the methodology, this paper will follow the process of health risk assessment to analyze the risk and benefits of existing air pollution control technologies in the city of Wuhan. The existing technology is selective catalytic reduction or SCR technology. Through HRA, the hazards of SCR are identified, the pollution affected by the hazard is determined, and the risks of the hazards are evaluated. The same process is done to the three proposed alternative technologies that also addresses NO2 emissions, which are low NOx burners, selective non-catalytic reduction or SNCR, and gas reburning. HRA, risk management, and risk-benefit analysis are conducted for each proposed technology to help select the best one for the city.
We now proceed with the risk assessment section of the case study. We will first discuss about the risk assessment without the project. So without the project, the identified hazard is nitrogen dioxide in the atmosphere. This can cause chronic obstructive pulmonary disease or COPD. The current existing guidelines for this is from World Health Organization with a concentration of 10 micrograms per cubic meter annual mean and 25 micrograms per cubic meter 24-hour mean. The local situation in Wuhan is reported to have significant amounts of nitrogen dioxide in the atmosphere, and it has only lessened during the COVID-19 lockdown. Now, this hazard can be contracted when staying in the open air in Wuhan. However, the NO2 levels were kept in check due to the new environmental regulations. Recent data shows that NO2 concentrations in the air are acceptable.
For the risk assessment with existing project, the selective catalytic reduction, the identified hazard is the use of ammonia in the process and the occurrence of ammonia slip into the atmosphere. It can cause respiratory diseases and severe chemical burns. For the hazard characterization, the EPA have given a standard for the annual mean PM2.5 values of 12 micrograms per cubic meter for secondary, 15 micrograms per cubic meter for primary, and 35 micrograms per cubic meter for 24-hour mean concentration. The WHO recommended lowering fine particle concentrations to significantly reduce the acute and chronic health impacts from air pollution. The WHO recommends yearly mean PM2.5 values of 10 microgram per cubic meter and 24-hour mean PM2.5 concentration of 25 microgram per cubic meter. Ambient air quality guidelines of the Republic of China follows WHO air quality guidelines. For the exposure assessment, ammonia can be inhaled, ingested, or absorbed through skin. Ingestion is the most common cause of burns and severe pain in the mouth, throat, esophagus, and stomach. The high concentration of PM2.5 increase the risk of respiratory diseases, including pneumonia. Because ammonia is lighter than air, it does not stay in low-lying areas. When mixed with moisture, it forms a heavier than air vapor that can spread in low-lying areas with inadequate air circulation. The US EPA states that the allowed ammonia slip levels vary from 2 to 10 ppm and pose no health hazards to people. For the risk characterization, the EPA and the WHO both used micrograms per cubic meter as a measure of exposure. The predicted PM2.5 exposure is 42 micrograms per cubic meter, which is substantially higher than the EPA and the WHO limits.
Proceeding to the risk assessment with low NOx burners, it is able to achieve 30 to 50% nitrogen oxide reduction. However, it has an identified hazard, which are unburned carbon, as well as higher emission of carbon monoxide. Characterization of this hazard according to OSHA, the permissible exposure limit or PEL of CO is an average of 50 parts per million or ppm during an 8-hour duration. What are the ways of exposure to this said hazard? Carbon monoxide can be breathed, and it displaces oxygen in the blood and deprives the organ of its needed oxygen. Small amounts of CO are present in the air daily. However, according to the U.S. Bureau of Labor Statistics, workers in steel mills are exposed to high concentration of carbon monoxide, and one of the industries in Wuhan is the steel industry. OSHA measures the exposure in parts per million for an average of 8-hour time period, and according to the Wuhan, Hubei, China's real-time air quality index, the 24-hour average of hourly reading is 4 gram per meter cube to 15 gram per meter cube. This is within OSHA PL but exceeds the ambient air quality standards of the Republic of China, which is a 4 milligram per meter cube standard CO level for a 24-hour mean.
This slide shows the risk assessment of selective non-catalytic reduction or SNCR technology. The health risk assessment of SNCR technology is similar to SCR. The hazard of SNCR is ammonia since this technology is high sensitive to ammonia slip. Ammonia is one of the components of PM2.5, so the air quality standards for PM2.5 are followed for this hazard. As given by Environmental Protection Agency or EPA, the annual mean of PM2.5 concentrations are 12 micrograms per meter cube and 15 micrograms per meter cube for its secondary and primary concentrations, respectively. Its 24-hourly mean is 35 micrograms per meter cube. The World Health Organization or WHO air quality standards promoted a shift to lower fine particulates concentrations to achieve significant reductions in risks for acute and chronic health effects from air pollution. In WHO guidelines, the standards for annual mean and 24-hour mean of PM2.5 concentrations are 10 micrograms per meter cube and 25 micrograms per meter cube, respectively. It is noted that the Republic of China's Ambient Air Quality Guidelines, or the National Standard GB 3095-2012, adhere to WHO air quality standards. Exposure to ammonia can be through inhalation, ingestion, and skin absorption. Among these, ingestion is most common. Since ammonia is gas, it can cause burns and severe pain in the mouth, throat, esophagus, and stomach if ingested. Again, ammonia is one of the components of PM2.5, so inhalation of high concentrations of PM2.5 increases the public's risk of contracting respiratory illnesses, such as pneumonia. So ammonia does not linger in low-lying regions for long periods because it is lighter than air. When combined with moisture, however, it produces vapor that is heavier than air and may spread in low-lying places with poor air circulation. The permissible ammonia slip levels, according to the US EPA, generally range from 2 to 10 parts per million and do not pose any health risks to humans. The metric of PM2.5 exposure is expressed in micrograms per cubic meter as used by both EPA and WHO. The estimated exposure of PM2.5 in the city of Wuhan is 42 micrograms per cubic meter, which is significantly larger than the given standards by EPA and WHO.
For the risk assessment of GR technology, though it is one of the most efficient and cost-effective technology that can reduce NOx emission, its process results in higher CO emission. In hazard characterization, the permissible exposure limit of CO exposure given by OSHA is an average of 50 ppm during an 8-hour duration. Comparing it to the state in Wuhan, its 24-hour mean CO level is 4 grams per cubic meter to 15 grams per cubic meter. This is within OSHA's standard of PEL of CO. People are exposed to small amounts of CO daily. However, inhalation of high levels can result to CO poisoning. Exposure is likely to occur on poorly ventilated or enclosed space with combustion appliances such as space heaters, ovens, and furnaces. OSHA measures carbon monoxide levels in ppm during an 8-hour time period. The ambient air quality standards of the Republic of China measure CO levels in milligram per cubic meter with averaging times of 24 hours and 1 hour. The ambient air quality standards of the Republic of China states that the standard CO level for 24-hour and hourly mean are 4 milligrams per cubic meter and 10 milligrams per cubic meter respectively. The real-time air quality index for Wuhan, China indicates that Wuhan's 24-hour mean CO level is 4 grams per cubic meter to 15 grams per cubic meter. These values exceed the CO level standards given by GB 3095-2012. Low NOx burners can achieve up to 65% NOx reduction when an average of 18% gas heat input. Though it can reduce NOx emission, it can result in higher levels of unburned carbon and higher emissions of carbon monoxide due to incomplete combustion with the staging of coal or air mixture. Over-fire air has a potential to sometimes reduce the CO emissions, but it still poses a hazard for human health. Selective non-catalytic reduction technology is based on a non-catalyzed chemical process that uses an ammonia-based reagent to reduce NOx into nitrogen and water. The reaction of reagents with the flue gas components resulted to NOx reduction. The difference of this technology with the existing technology in the study area, which is a selective catalytic reduction, was the process of adding catalyst. SNCR is a proven technology that is efficient in reducing NOx about 40 to 70%, and it has been since 1974 with 300 systems installed globally. Gas reburning technology reburns NOx from the primary zone of boilers and converts it into molecular nitrogen and other reduced nitrogenous species. To convert the remaining reduced nitrogenous species into molecular nitrogen, OFA is injected in the downstream of the reburn zone. Similar to LNB, GR emits carbon monoxide and unburned carbon, and to address and minimize that hazard, optimization of OFA injection rate is necessary.
We will now discuss the risk and benefit analysis of this case study. First, we have the cost equivalent of identified risks without the project. It was found that COPD costs approximately $3,669.33 per patient, and that the average hospital stay for this illness is approximately 9 days. The minimum wage in Wuhan is found to be 19.5 US dollars daily. Using these values and a design period of 20 years, it was calculated that the income loss per patient is $42,120.
This slide shows the cost equivalent of the identified risk of each technology when they are implemented. From the table, the income loss for all technologies is $42,120, as earlier explained. For low NOx burners or LNBs, the approximated financial loss due to CO poisoning is $12,188,000,000, assuming that 0.5% of the city's population inhales high CO concentrations due to lack of maintenance. And the average medical expense for treating CO poisoning is $110,000 per patient. For SNCR or Selective Non-Catalytic Reduction Technology, the estimated financial loss due to pneumonia is $16,620,000,000. This value is estimated by assuming that 0.5% of the population contracts pneumonia due to improper SNCR maintenance, and the average hospitalization cost for each patient with pneumonia is $150,000. Similar to LNBs, using gas reburning technology can produce high levels of CO. Therefore, assuming that 0.5% of the city's population would be affected, the total hospitalization cost is also $12,188,000,000.
Here we have the rough estimates of the total cost of project, which includes capital and operating expenses for each of the three technologies. The highest installation cost is that of the low NOx burners with $452,727,130.96 US dollars. And the least is for gas reburning or reburning technology with $209,263,736.80. The project with the least total cost is for gas reburning, with a total project cost amounting to $286,767,728.80, followed by selective non-catalytic reduction with $471,028,058.53. And the most expensive project cost is that of the low NOx burners, with a total of $529,977,234.96.
Now, for the monetary amount of benefits of the project, recall that in Part A of the risk-benefit analysis, it was found that COPD costs $3,669.33 per patient. It was also found that this illness affects about 8.6% of the adult population in China. Applying this percentage to the population in Wuhan, It was approximated that 952,880 individuals are affected by this illness. However, with the application of any project mentioned in this case study, the risk of COPD is removed. Therefore, the total monetary benefits as averted COPD cases in a design period of 20 years is computed to be about $69 billion, nearing 70 billion approximately.
The conclusions will show the summary of the project cost, benefit cost ratio, unaddressed risk, net benefits, and benefit risk ratio. First is the total project cost, and it shows that the low NOx burners have the highest cost and the gas burning with the least cost. The total benefits for each technology is 3,496,431,170.4 US dollar per year. And the table also shows the amount saved by the city through the averted case of chronic obstructive pulmonary diseases. For the benefit cost ratio, it is computed by dividing the total benefit and the total cost of each technology, and it shows that all are feasible in addressing the risk since the ratio is greater than 1. The highest ratio observed is for the gas reburning or the reburning technology, which means that it has the highest benefit per cost. The benefit cost ratio of the low NOx burner and the selective non-catalytic reduction are of the same range of the benefit cost ratio.
In quantifying the unaddressed and residual risk, it is assumed that 0.5% of Wuhan's population are affected, or 110,800 people. It was identified that selective non-catalytic reduction could cause acute lower respiratory tract infection and pneumonia, and this have an estimated hospitalization cost per patient of $150,000. The approximated total cost of this risk is 16 billion and 620 million US dollars. Both low NOx burners and gas burning technology have been identified to pose risk of carbon monoxide poisoning, which has a financial cost of 110,000 per patient. This brings the total cost of the unaddressed risk for low NOx and gas burning to be 12 billion and 188 million dollars. Based on the financial cost of the unaddressed risk, low NOx burners and gas burning have a lower total cost of the identified risks. Considering the total project costs as well as the total benefits of the three technologies, the net benefits can be calculated by subtracting the total project cost from the total benefits equates to 69,928,623,408. Based on computations, the highest net benefit is that of gas reburning or reburning technology. The benefit-risk ratio is the ratio of the net benefits with the identified total project risk. A benefit-risk ratio greater than 1 means that the project is feasible and the project can be proceeded as planned. Based on computations, all three technologies have benefit-risk ratio of greater than 1, which means that the project could be implemented. Both low NOx burners and gas burning technology had the highest benefit-risk ratio of 5.7.
To determine the most efficient and feasible technology, cost of each technology, benefits, benefit-cost ratio, and benefit-risk ratio are computed. The benefits and unaddressed risks are monetized to easily compare it with other factors. The most feasible technology that can be used to address nitrogen dioxide in Wuhan, China is gas reburning technology. It has the least total cost with high benefit, thus having the highest benefit cost ratio. Its net benefit is the highest compared to the other two suggested technology. Since it has the least amount of unaddressed risk and highest net benefit, the calculated benefit risk ratio for the said technology is 5.7, which indicated the potential of the technology to be more beneficial than detrimental. Since it produces another pollutant, one recommended method to reduce the residual risk is to optimize the utilization of OFA to further reduce carbon monoxide and unburned carbon emission. So all in all, the gas reburning technology is the most feasible technology that can address nitrogen dioxide in Wuhan, China. So that concludes our report. Thank you for listening.